Good morning, Dr. Srini.
Hi, good morning. How are you?
Yes, doing good. Thanks for joining.
Thank you.
Would you like to have a try of whether you are able to
Share
stream?
the screen.
Yes.
Yeah,
Uh,
yeah.
Let me make you a co-host first.
Can you give the privilege? Yeah,
Yes.
privilege. Yeah. Can you able to see my screen?
Yes, I'm able to see. That's fine.
Yeah. I'll stop right now. So once
Yes.
we started, then I can again.
Yes. That's
Is that fine?
yeah.
Rajat?
Yeah. That's fine. That's fine.
Yeah, yeah. So how is everything in India? Is everything is good?
Yes, it's
All students came back to the campus and running classes.
yes. Students are back to campus, and it's Ugadi today. Happy Ugadi for you as well. Am I audible
Hi,
to you?
Dr. Shivkumar. Can you hear me? Uh,
Can I check with you? Are you Srinivasalu or Srinivasali?
Yeah, yeah. You can call me Kasa also. That's
Okay.
fine. The most, yeah. Uh, so can you able to hear me?
Yeah, I'm able to hear you.
Oh, okay.
So what's the time there now? It must be late night, I think.
It's it's 11:30 midnight.
Okay. So I was
That's why
checking back.
I requested Dr. Shivakumar at least initial hour, so that will be easy for me.
That's right. Because I was checking back to see what is the time in US. Then I understand you are from Ohio. So I was wondering
Yeah,
it must
correct.
be late night for you because 9.5 hours back from Indian time.
Yeah.
That's fine. How's things there? It's still cold there in Ohio?
Yeah, it's now spring started,
Mhm.
but still it is around 5 degrees, 6 degrees in
Okay.
daytime. Yeah, still
And you
cold.
have cherry blossoms there, I think, right?
Yeah, correct. Yeah, it's so this April second week it ends the cherry blossoms. Yeah. Mhm. So overall, how many pharmacy students in our university are today joining?
Overall, we have, I think if you are talking about late semesters, in semester 8, we have around 33 students. In semester 6, we have around 48 or something, I think. And
Mhm.
when you come earlier semesters, the strength is a bit high.
Okay.
Semester 2, there we are having about 60 students, 58 to be precise. So
Okay.
it's a very early school. It's the fifth year of pharmacy in Geetham.
Nice, nice. Now I know the Geetham is from Visakhapatnam, Vizag, right?
That's the
So
parent campus. This Hyderabad is a comparatively new campus, and there is another campus in Bangalore as well.
so between you are frozen. So is there any my network issue or your network issue? I'm not understanding that. Yeah.
Really, maybe a network from my end because I'm able to
Oh,
see you clearly.
oh, okay, okay.
So if I address you as Srini, is that fine for you or?
Sir, good morning, sir.
Yes, good morning.
I'm Geeta, sir.
Oh, yeah. Yes,
Uh,
thanks. Can you please turn on your
Sir,
can you please turn on your video? You have joined us. Hello.
sir. Good morning, sir.
Morning. You have joined us, Malarkodi Velraj. Is that you?
Sir?
On what? Because I'm not able to see your name in panelists.
Yeah, like I didn't receive the panel list, but principal sir has given me one link, so I have
Okay.
joined.
Okay, that's fine. So your name is displayed as Malarkodi Velraj. Is that right?
No, I'm Geeta, Dr. Geeta.
Okay.
Second speaker, sir. Second speaker of today.
And I understood that. I'm just trying
Shall
to.
I rename, sir? I
Oh,
have
yeah.
to read.
No, it's okay. I'm just trying to figure out which name you are in. Okay,
Okay.
I got it.
Okay, sir. I think I have, like, I have got as Shivakumar Ji, principal, sir.
That's fine. That's fine. So I'm making you as co-host as well.
Okay, sir.
So it's
Okay.
easy for you to share your screens later.
Okay. After the, like, after first speaker, sir, I will do mine.
No problem. Yeah.
How are
Madam,
you, sir?
Madam, very
Yeah.
good.
Very good morning, sir. Very good morning.
Ma'am, thank you for the thank you for accepting our invitation and being a part for us for today delivering a lecture. Yeah.
Thank you. Thank you, sir. Thank you very much. Happy morning, sir.
Thank you, ma'am. Same to you. Yeah. Ma'am, hope the things are fine, ma'am. I think we were not able to connect to you in the mails and other things. We are stuck up with a lot of things. So please accept our apologies. Yeah.
So, sir, no issues and no formalities, sir. We will have a nice meet. Like, you have given me an opportunity, I will do my level best.
Thank you, ma'am. Thank you so much for your kind words. Yeah.
Thank you.
So,
Shall
yes,
I close my video right now?
yes, ma'am. You will be able. You will be able to join by means you keep the video on, ma'am. Sorry, you can unmute your video, ma'am. No problem. Yeah.
Okay. Okay, sir. Thank you, sir.
Thank you, ma'am.
Okay.
Morning, Dr. Shivakumar.
Yeah.
How are
Very.
you?
Srinivasulu, how are you?
I'm good. I'm doing good. Thank you.
Yeah.
Hope everything is good there. So
Yeah.
students maybe they are coming back to the classes and all.
Yes, Srinivasulu, everything is fine. First of all, I wanted to thank you for accepting our invitation. Okay, and wish you happy Yugadi. Actually, today
Yeah,
is.
thank you. Wish you to all.
Yes,
Wish you
yes.
to all. And also it is a good opportunity for me to. It's my pleasure to give the simple talk, but it helps to me too.
Yeah.
Thanks for giving that opportunity for the entire team and Shivakumar, Dr.
Yeah.
Shivakumar.
Thank you, Srinivasulu. Actually, we are also, Geetam is in association with Hikma Pharmaceuticals also.
Oh.
We are from the School of Sciences. We wanted to have an extramural laboratory for executing PhDs from your lab. So we are having a tie. We have a very soon. I think we are going to have a tie-up with Hikma.
Wow. Okay. Yeah, Hikma do that. These kind of activities is good. Even recently in the here in the United States, I prepared a chemistry exam for the Science Olympiad. So it is volunteering from the Hikma. So we do some kind of the voluntary job in here in the Saturday Sunday. On behalf of Hikma. Yeah, they do a lot of social activities and encouraging to the universities and the students.
Well, I think if you would able to appreciate and initiate an MOU for us, so that what we can try to do is you have a lot of expertise at your end. So what we expect is from your end to deliver lectures on a constant basis, so that we can exchange the ideas and expertise at what is happening at your company. so that
industry,
students will be able to know what are the things that are happening at the various pharmaceutical industries and so on. So we would be very happy to welcome you to have an MOU, so that it would be having a good knowledge sharing to our students. Yeah.
It's all my pleasure, Dr.
Yeah, nice. Thanks all to Dr. Ravi, who has initiated the discussion.
Yeah, he is my ex-friend. Yeah, he is my friend. So just we had a talk on the, so is there any opportunity we can give in India, any kind of universities or any in our circle? So the Ravi and Dr. Ravi is immediately, we know. It's good. It's immediately connected.
Me, Ravi, and the other invitee, the panelist, Dr. Kingston, we all were colleagues at International Medical University. We had very close interactions with Ravi. So it was a good interaction. Then we have moved back to India, and he's in Malaysia still continuing with another university, UIT. Yeah.
Oh, okay. You might know the Raju also, Raj.
Yeah. Why not?
Oh, okay. Okay, he is in Belfast, right? Yeah.
Yeah, he is in Belfast. Yeah, we had some interaction in the before session. Like, I think we wanted, we were requesting Ravi, can you help us for some of these guest lecture kind? So Raju also from Belfast, I think once we had discussion to have a negotiation or a collaboration with a project. Okay. There was a project, collaborative project works from India and other countries. Yeah. Maybe if we have a MOU, maybe we can also include that. For example, we can both can collaborate for writing a proposal, and there is a funding known as Indo-US research project proposals. Okay. So expertise from your end and expertise from our end, both will write a proposal and submit to the UGC. Okay. And if it gets accepted, the funding will be done, and then both the participants will be able to share their expertise to complete that research work and come in terms of outcomes in terms of basically publications and so on. So it would be a mutual benefit to both of us. Yeah. Sharing of knowledge is always good. Yeah.
Yeah, sharing of knowledge and and another thing is the updating the technology also, it will be helpful for us, even the industry, because the universities may not know the current technology, but with that help only we can update in the industry. They go to universities and they do the research, then only they will implement into the industry most of the new technique.
Yeah. Very nice, Srinivas, for your kind words and discussion. Are we all set, Kingston? Can we able to?
Yes, we have 4 minutes delayed. We can start now. It's time for us to start.
Yeah.
Okay.
Yeah. You can start the recording session also, so that it would. Kingston. Yeah.
Yes. Recording is on.
Yes. Thank you.
A quick question, Shivkumar, Dr. Shivkumar or Kingston Raja. So you want me to introduce myself, or anyone can introduce how it is, or you can directly start from my presentation?
No. We will do that. Just
okay.
give us, so we'll have a formal discussions and then we will do it. Yeah, please.
Correct. Okay. All right.
Okay, let's start today's webinar. Good morning, participants and our guest speaker for this webinar. On behalf of Geetham School of Pharmacy, we wish you all a happy Ugadi. We have 2 sessions today. Our first session is from 9 to 10 a.m. and the topic for this session is development and evaluation of particle size analysis and its application in pharmaceutical suspensions. Now I call upon Professor Sivakumar, the head of Institute, Geetham School of Pharmacy, to deliver his welcome address.
Thank you, Kingston. A warm welcome to the resource persons of today's session. Dr. Srinivasulu Kasa, and all the participants. I would like to take this opportunity to wish a happy Ugadi to all of you. And I would like to thank Dr. Srinivasulu for accepting our invitation. This session that we were being initiated since few months, and now it has been activated and then finalized to have a session with Dr. Srinivasulu to our students. So it's a great interactive session that we would be able to listen from Dr. Srinivasulu. Thank you once again, Dr. Srinivasulu, for accepting our today's lecture session to share your knowledge to our students. With this welcome note, I would like to request Dr. Kingston to introduce today's speaker for the session. Thank you.
Thank you, Professor Shivkumar. It's my pleasure to introduce our guest, Dr. Srinivasulu Kasa.
Thank you, Dr. Shivkumar.
Yeah, it's my pleasure to introduce our guest speaker, Dr. Srinivasulu Kasa.
Thank you, Dr. Shivkumar,
Technical Affairs at Hikma
for
Pharmaceuticals,
the
United States.
introduction, and it is my pleasure. Yeah. So today I'm going to talk about the development and evaluation of particle size analysis and its real application in the pharmaceutical suspensions. When we go to the outline of today's topic, so we'll discuss on the background of the topic and what are the need and challenges associated practice. The common issue, the rest of the world, from the FDA or from the EU market. So what are the common issues when we are doing the suspension products? What are the challenges we are facing? What are the expectations from the FDA? And some of the examples and case studies I'm going to present today. So basically, the particle size, when you see the dosage forms of the drugs, so there are a lot of dosage forms available in the market, like solutions, suspensions, aerosols. So out of these all, the suspensions is the very the challenging, and it is very critical to produce the generic products in the market, because the suspensions, the API will be in the undissolved form, and all excipients will be in the soluble form. So the main issues here is evaluating the equivalency between the current generic product versus the reference listed product. And also there are the challenges associated with the particle size. So one is the exact API, the API particle size, and excipient particles are, if there are any excipients is suspended along with the API particle size, that will be a very challenging to develop the particle size analysis. And if there are the multiple API products in the same API, there are the byproducts will be formed. So that will be establishing the particle size for the two different APIs in the same product will be very challenging. And also, if API has a more than one polymorphic form, so if it is in the suspended in the aqueous solution, so how it turns into the different forms? It turns from the form 1 to form 2 or form A to form B. So these are the common challenges when we are evaluating the particle size. And expectations from the regulatory agencies are, suppose if we are going with the Q1, Q2, so the Q1 is basically the qualitatively the same components when we are comparing the reference product. Or reference listed drug. And the Q2 is the commonly we can see that where the, suppose there are the 4 excipients, one API is there in the product, the Q1 will be the same components will be there. The Q2 is the same exact amount, it should be there in the product. And the expectations from the recent guidances and the recent expectations from the FDA is there will be a Q3 also has to be matched with the reference drug product. So what is Q3? Q3 is generally it is a physicochemical similarities with respect to the reference drug product. So that means, so when we are saying that Q1, Q2 is matching, so FDA is expecting to match the Q3 also. The Q3 is the arrangement of particle size, how it is the shape of particles. It is the regular shape or a needle shape, or how it looks to the our generic product, how we are comparing with the reference drug product. So when you see the general flow chart of the approvals from the generic drugs, so suppose if you have a Q1, Q2, so if you achieved the Q1, Q2, and it is compared to Q3, so it is ready to go with in vitro bioequivalency. So usually the in vitro bioequivalency requirements, when you see the product specific guidance in the market, so some of the physicochemical characteristics like pH, viscosity, osmolality, specific gravity, and XRD. XRD is related to the polymorphic form. Other than these physical characteristics, there are the two major elements in the in vitro bioequivalency. That is, one is particle size, and the second one is the in vitro drug release, like dissolution. So when we can match all these characteristics with respect to Q1, Q2, Q3, so the FDA usually they give the approval to go into the market. So if it is failing to the Q1, Q2, and Q3, so definitely we should go to the in vivo bioequivalency and show the equivalency and the clinical endpoint. So the main challenges in the product specific guidances is, one is the dissolution, and second one is the particle size analysis. So today we are going to discuss more about the particle size distributions. So what are the common techniques the industry can use to determine the particle size distribution, and what are the expectations from the FDA, and what they are asking to developing the methods for the suspensions. So the most of the industry, they use the maximum use the laser diffraction. So we can measure from the 30 nanometer to 3000 microns, and there are the laser light obscuration. Usually the laser diffraction is master size at 3000 or 2000. So these are the two and the subvisual particles. So the subvisual is a HIAC system. Usually that is a determination. Usually the light obscuration usually used for the electron microscopy, usually to determine the Q3. Usually when we talk about the previous slide, Q1, Q2, and Q3. So electron microscopy will help us to determine the what is the shape and how it is arranged in the particles in the product. And the image analysis and the dynamic light scattering. The DLS is the like a jitter sizer. Usually we use for the very low submicron or the emulsions we usually use for the dynamic light scattering. And this is the new technique recently FDA introduced into the industry, the morphologically directed Raman microscopy. So when we can choose the morphologically directed Raman spectroscopy is when we have a product with two different APIs, or when you have a product with the API and also the one of the excipient also suspended into the suspension. So the conventional techniques like laser diffraction or the light obscuration or whatever the other techniques, we cannot determine exactly, because there is a other excipient or other API is interfering with the other another particles. So this is the common technique. The morphologically directed Raman spectroscopy is specifically we use for the quantification of any two APIs or the interference with the other excipients. And this is the moles, and the nanoparticle size usually we use for the aggregation of the particles. And industry, we usually use the laser diffraction is the most popular technique for the, it is easy to handle the quality control, as well as the development will be easy for the laser diffraction. So how it works, the laser diffraction? So the laser diffraction is the most popular technique, and it is wide dynamic range to use the pharmaceutical industry, because it is used from the 30 nanometer to the 3000 micron size. That is the submicron to the higher micron size we can use for this technique. So when use the laser diffraction, there are the two theories involved into the analysis. The one is the Fraunhofer theory. The Fraunhofer scattering will be applicable when the particle size is greater than 50 micron. So what will happen if you measure the Fraunhofer theory with less than 50 micron? So the Fraunhofer theory will not applicable because it will not take the optical properties like refractive index and absorptive index. Density values will not take into the calculation for determination of particle size for Fraunhofer theory. So there are some limitations, because the current industry is looking for the less than 50 micron size for the suspensions. So the Fraunhofer theory, because of the limitations, the my theory came into the picture. So it applicable from the 0.03 micron to 3000 micron. So when the main agencies, when you are determining the particle size less than 50 micron, so some of the companies or some of the industry, they are using the Fraunhofer theory for determination of particle size. That means what they are doing is either they are overestimating the particle size, or they are underestimating the particle size. So which is not true. So the industry needs the exact particle size that really impacts to the patient. If it is suppose the intramuscular suspension, it is definitely need the D99 or D100 particle size to know that. Otherwise, the patient will get the irritate when it is injected into the intramuscular. So the particle size is the very the popular technique and the major critical quality measure attribute for the formulations, because it is in dispersion state with like suspensions and gels. And also, as we previously, it is a very critical, and it is a in vitro bioequivalency, the major critical test for the in vitro bioequivalency, because the recent PSGs, product specific guidance from the FDA, the in vitro bioequivalency, so particle size they have to show with the populated bioequivalency. So the main advantage when you go with in vitro bioequivalency is, so the industry can save the money and the time. So this is the very good route when we can get the approval from the easiest way without spending the much the cost, because we can save the RLDs and we can save the time, because the only the requirement is populated bioequivalency from the particle size and the in vitro drug release. So what are the expectations from the FDA on the product specific guidance on the particle sizes? So they are looking for the populated bioequivalency statistical approach like a T/R ratio. The T/R ratio means the test particle size analysis of D50 the divided by reference product D50 should be 0.9 to 1.1. So that will be span also. The span is basically, it is from D90 minus D10 divided by D50. So these two values are the common PSG refers for the from the FDA specific product specific guidances. So what are the main challenges when we are when we are developing the particle size method? Or there are a lot of when we are developing the method, we need to look at the carefully how the suspension product behaves into the solution. So when you are shaking the suspension, how much time it is getting into the homogeneous to mix the sample, and also how when we are going for the laser diffraction technique, the dispersion selection is very critical. Suppose if you are selecting any dispersant, In the dispersant, the particles should not float on the solvent. If it is floating on the solvent, that means that there is a surface tension. There is a lot of surface tension variation between your liquid and the particle size. That's why the particles are floating on your dispersant. So to mitigate this problem, so usually we recommended to use that is a tween or the surfactants. Usually the surfactants will reduce the surface tension of the medium, and it will be easily homogeneous into the dispersant. But there are the challenges when we are going with the tween 80 or other surfactants. We need to see the solubility of the particles into the when we are selecting the dispersant medium. How much solubility it is dispersing. So is there any aggregates are forming, or is there any lower particles are easily soluble in the dispersion medium? That is the right selection of the dispersion medium. Your particles should not soluble in your dispersion medium. And the sample preparation. Suppose is there any dilutions? Is it needed for the sample dilution, or any extraction, or any sonication? The sonication is the main challenging the application when we are using the laser type action technique. So because when the suspension products usually do over the period of stability, it forms aggregates because of the lower size of particles. When you are not applying the sonication, the aggregates will not deaggregate, and it will become as a it is end up with the higher particle size. So sonication is a good tool to deaggregate into the particle size. But also there are some challenges when you are applying the sonication, and when you are developing the method, we need to make sure that that particle is breaking, or it is a particle is deaggregating. So how to make sure that that particle is breaking, or the aggregations are deaggregating. So there is a orthogonal technique for this laser diffraction when you are applying the sonication. Once we are adding the sample into the sonication, before the sonication and after the sonication, take the little bit sample and run the microscopy to see that how the pictures is that breaking the particles or the deaggregating the particles. And the instrument and software settings like laser power, how much laser power are we using, and steering speed, and sonication, as we discussed, sonication time, and the optical inputs. So optical inputs, usually when you are applying the my theory, we need to provide the refractive index of the particle. So usually we can get from the literature or the API supplier, or otherwise we need to establish the refractive index of the API, and also absorptive index of the your API particles. And also, is there any specific interference from the excipients? Suppose some of the formulations, based on my experience, carbomers usually they will not soluble in the formulation. Usually they will be settled along with your API particles. So what will happen when you add the sample into the particle size analysis? Because of carbomer, it leads to the higher particle size or the lower particle size. So what we can do when there is an interference of the excipient, there are the sample preparations. We can make it into the either acidic pH or the basic pH, or without affecting any API particles. And this is the very rarely we can see that more than one API in the formulation. But if there is a more than one API in the formulation, so what type of techniques we can use to determine the individual particle size? So these are the common, the recent common deficiencies we can see from the agencies. The incorrect choice of instrument techniques, like are using the my theory or Fraunhofer theory, and the laser when we are using the laser diffraction. And usually for the emulsion products, laser diffraction is the not right technique. But usually some of the products, so they, instead of using the DLS, so they selected the laser diffraction as the easy common deficiency. We can see that. So the selection of the technique is the beginning is very important. Use of material display analysis. So when we submit to the agency or the approvals, so we should know that is that the cumulative distribution or the regular distribution, how we are doing the distribution analysis. So usually it requires to volume weighted distribution for the when you are using the laser diffraction. So when you are going with the jitter size at DLS, so intensity weighted distribution is the recommended techniques. So some cases it is a mismatch. So usually we can get these kind of deficiency when you are not selecting the right distribution techniques. And see, even though it is a very simple technique, but the expectation from the, because this is the major the technique used for the in vitro bioequivalency. So it is recommended to do the method validation for the particle size distribution, like repeatability, reproducibility, robustness, and also as the orthogonal technique, the microscopy is the very important to support these kind of techniques. So is there any sample preparation, like any interference from the excipient, how we are removing the interference by adjusting the pH of the formulation? So those preparations definitely should be dictated into the method. So if you are missing, so this is the contingency. So the impact of the dispersion medium. So usually the particles can exist in the three forms, like gas is the liquid and solid. Like a gas is the aerosols, and liquid is the emulsion, and solid is the suspension. So these are the particles exist in the three forms. So it should be discussed about more clearly that nature of the dispersion medium, how it is, like solid in liquid, or liquid in liquid, or liquid in gas, and solid in gas. So as we know, this is the solid in liquid is the suspensions, gels, and the liquid in liquid is the emulsions, and liquid in gas is the nozzle sprays, and solid in gas is the powders, granules, and aerosols. So based on the above, the three forms, so you should be establishing either the emulsions or suspensions or the granules. Like usually what are the common issues we can see when you are selecting the water? So you can usually get the bubble peaks when it is in around 400 micron or 500 micron. So we can see very clearly that is that bimodal peak or the single modal peak. When you is that really bimodal peak, or is there any issue with the wrong selection of the dispersion medium, or wrong selection of the optical properties? And also when you are selecting dispersion medium, we need to clearly very clearly observe that how the obscuration can go when you are running the time. So the obscuration should be constant always. When it is the obscuration is going down, so there will be, we can suspect that there are the particles will be dissolving into your dispersion medium. So then only it can go to the obscuration the obscuration result will be reduced. Otherwise, obscuration always should be constant. When you are adding the sample, when you are selecting the right dispersion medium. Yeah, there are the couple of so when you are seeing the bimodal peak, so there will be properties that would lead into the bimodal peak, and the drug particles are dissolved during dispersion medium, like they can float on the medium, or there will be aggregation. So aggregation, we can easily remove aggregation because of the higher speed of RPM or the sedimentation. Suppose if the particles are dissolving in the dispersion medium, even though if we are going with the surfactant, we are adding the surfactant, there is no other option other than the water and surfactant. So usually what the industry will do, they will pre-saturate the dispersion medium with the active API. Some time to saturate the water, but saturated medium, so there is no additional particles will not dissolve into the media. So that's the recommendation even from the FDA, that so use the pre-saturated dispersion medium for the particle size analysis if there is a criticality in the dispersion medium selection. Sorry. Yeah. So if there is an interference from the excipients, what we can do? So there are the, as I discussed earlier, so we can adjust the pH of the formulation. So it can soluble the excipient, or otherwise you can, what we can do, we can remove the interference excipient by run the as a placebo into the particle size analysis as a background, and then once you eliminate from the placebo from the formulation as a blank, then we can see that the good histogram. There's one of the case study we can see here as a carbomer. So before eliminating the placebo formulation, so we are quantifying this one and determining particle size, you can always go to the higher particle size. So after eliminating the blank subtraction from the placebo, so because placebo has a carbomer, so you can easily see that the good histogram. So these are the common the histograms. There are the examples. So yeah. So these are the one of the histogram example. Reduce the pH of the formulation, so we can eliminate the interference from the excipient. So this is after eliminating of excipient interference with the active particles. So we can see that exact the histogram. So here we use 0.6 sodium chloride solution as a diluent carbomer excipient. So the example, the histogram for the when you are selecting the aqueous medium as a dispersant, usually we can see that around 400 500 micron. So this is sometimes when you are removing the oxygen from the water, so you may not get, but it is on and off. Better to not select aqueous dispersion medium. Always better to add some little bit surfactant as a tween 80 or the tween 20 as a dispersion medium. So if you are selecting the wrong optimum model, we can the D10 values always will go to the. So when you select the right op, we always get the right histogram. So that means the selection of dispersion medium, selection of sonication, selection of optical properties. So these are the majorly when we are developing a method for particle size, we need to keep in mind that. So these are the major elements we need to evaluate individually. So in summary, so the particle size is a very critical attribute for the suspension products. So we need to evaluate very systematically with a scientific background, and also we need to evaluate each individual parameter to understand that how it is behaving when we are running the development trials. And also this affect this particle size when you are developing in the right time with a good method. So that helps to the industry that as a in vitro bioequivalency. So we are saving a time and we are saving a cost. So it is important to ensure the method is properly developed and adequately validated before going to the exhibit batches and the formulation developments. So correct interpretation of the results relies on the full and complete is very, very important. So what are the requirements for the product need to be understand and interpret properly. So the physical nature of the always choose the methods to
Thank you, Dr. Srini, for your presentation. Let's open up for the question now. So if anybody has any question, you can keep posting on the question and section. So it will be easy for us to communicate with Dr. Srini. So I request the participants to post the questions in the question area. Okay, let me begin with the first question, Dr. Srini. Thanks for your detailed explanation how the drug discovery works and the examples what you have given for histograms and what are the sophisticated softwares used into that. So let me put a question to you. Let's say that if our students who's having a theoretical knowledge in terms of pharmaceutics, if they have to get a job for industry as a beginner, what are the skill sets they need? Do they need any hands-on training of instrumentation? What is your thought about that?
Can you repeat the question because it was breakdown in between?
Okay, my question was for the students who are in semester 8 or who is exiting the university campus. If they are coming for a job opportunity, let's say that they may have a theoretical knowledge in terms of pharmaceutics. They may not have extensive hands-on activities with instruments. So if they have to get a job opportunity as a beginner, do they need a hands-on activities or skill sets which is needed for them? Or a basic theoretical knowledge would be sufficient for them to secure a job?
So basically, so what will happen once they get into the industry? So there will be a training session for the each instrument. So that will be easy if they have a theoretical knowledge. It will be easy to understand for the training course. Yeah. Is there any general method or protocol to select the? Yeah, there is a one question I see. Do particle shape has an effect on the final result of the particles size analysis? And for the laser diffraction, so no. The shape of particle, how it differs in the laser diffraction is it will become as a circular, even though it is elongated. So my theory, it will become as it makes as a circular, and it calculates according to the pi r square h. So, but it will affect the Q3. So the shape of particles will impact on the Q3 when you are going for the either the microscopy analysis or the EMR analysis.
Okay, that's fine. There's another question. Is there any general method or protocol to select the solvent or disposing system for hydrophilic and lipophilic drugs?
Lipophilic drugs.
Yes, Srini, can you repeat that? I think your voice
Yeah.
was
So
breaking.
oh, okay. So to answer that, Dr. Sunita's question, so usually the suspension is suspended into the water system, basically, right? So that's the major. As the water, they need to see that the solubility in the water, how much it is soluble. But when you are going with the opposite solvent, so the particles definitely it will go into dissolve. So that's not the right technique.
Okay, there's another question. Is one of the challenges with nanoparticles is solubility. How to address it, especially
So,
using for in vitro and in vivo?
can you all hear me? Yeah, one of the challenge nanoparticles solubility, how the address is especially in vitro and in vivo studies. The in vitro studies, basically nanoparticle solubility, it goes into the nano site. There will be another technique, it goes to the nano site. So the in vitro studies, along with the particle size, there is a complementary test of dissolution. So when your particle size changes, your dissolution rate will be changed along with your RLD, reference listed drug.
Okay, Srini, there is a person who wants to ask a question directly to you. So I'm just unmuting the person. Dr. Sunita, are you able to speak?
Yeah, good morning.
Yeah.
Can you hear me, Dr. Kingston?
Yes, Sunita, you can go ahead.
Yeah. Good morning, Dr. Srini. The talk was very good. It was, you have given more insights into the particle size analyzer. In fact, we were using this particular particle size analyzer, Malvran, in my previous institute. So I just had one question. So we were involved in the preparation of a nanosuspensions using chitosan and twins, okay, for the nose to brain delivery. Then in that case, what we have done when we were analyzing the particles with the Malvran digitizer, it was giving in the nanometer range, but it was going up to the 500 nanometers. But when the same sample, when we have subjected to the SEM analysis, the particles were in the range of 100 to 150.
Hear your question clear. I'm sorry, I'm not clear.
Yeah.
Hear
Can
your
I repeat
question.
it? Yeah. Can I repeat the question? Yeah. Now, can you hear me? Is it clear?
Yes, Sunita, go ahead.
Yeah. The question is, we have prepared nanosuspension. We have analyzed the particles by using initially with the Malvran digitizer.
Okay.
There, the size range was like it was going from 100 to 500 and even up to 600 also. But when the same sample we have subjected to the SEM analysis, scanning electron microscopy.
So the digitizer is you can.
Yeah.
Yeah, please continue, Dr.
The same sample when we have subjected to the scanning electron microscopy, in fact, the particles were even less than 200 nanometers, all the particles. So why this particular differences with the Malvran digitizer and the SEM? Why the actual size is not getting reflected in the Malvern digitizer.
So Digitizer, how much you got?
Yeah, we were having a range. It was showing up to 500 nanometers, 560
You got in
nanometers.
Digitizer.
Yeah, Malvern digitizer.
500. Am I right? At 200 you are saying.
Yeah, 200, less than 200 we were getting, and all the particles were homogeneous in case of when we have seen the sample under scanning electron microscopy.
Oh, okay. So is that all the optical
Your voice is breaking, sir.
in the Digitizer?
Can you please repeat?
So there are only the two issues.
Yeah.
When you are as you are selecting as orthogonal technique as make sure that the you are loading. If you are loading the
Yes, Rene, I think your voice was breaking for us. We couldn't get the things very clearly. Anyway, let's move on because of the time concern. Take another quick question. There's another person. Let me allow that person. Yes, Subramaniam Pichika, you can go ahead.
Yeah, good morning, Srinivas sir. It was really to ask the question. I have a couple of questions. Is my voice audible, Kingston sir?
Yes, go ahead.
Can you come a little bit closer to the device? Yeah.
Is that okay?
Yeah, yes, Subramaniam, go ahead.
Yeah, fine. Let me just ask you a couple of questions, which I basically have a doubt in this. I've gone through some articles as well as when I'm doing some experimentation. There is a need of wet method and dry method when we are determining the particle size determination. What is the real purpose? Why we have to shift to dry to wet? Like, is there any specific reason that we have to shift just because of the solubility or any other issues?
Yeah, so today we covered only for the suspension products particle size. So when we are discussing the API, usually the dry methods will be applicable for the API products. So only if you have a active product ingredient. So because that needs the dry method, and also there are the solubility issues. You cannot select any dispersant because when you have a product, it is soluble in all the solvents. If you select any solvent, whatever solvent you select, it will be dissolved. So there is no option for the wet method. So you have only option for the dry method.
No, there are quite number of APIs. When I was working, I felt the problem with the dry method because it was not appropriately giving me a result because of probably the agglomeration of the particles and so on. So when that problem was arised, I just switched over to a more feasible method, that is wet. But basically, is that the reason why we choose wet method, or is there any specific reason for selecting this out of these two methods?
No, always a wet method is the 100% accurate method. If the product doesn't have a solubility issues, so always wet method is the preferred method.
Okay. So let me ask you one more question. If suppose I am using a two combinational API for determining a PSD of my formulation, if suppose there is a solubility issue of one particular API out of two in a combination product or a formulation, what I'm experimenting right now. And if I want to check the PSD of that particular thing in wet method, suppose that suits to be a best suitability method out of two. So because of the solubility issues, if one API is unable to be predicted in more appropriate way, then what is the other go, how I can determine it? Because the plasma.
So, yeah, Subramaniam, that's the good question. Yeah, that's a good question. That's why we need to pre-saturate your dispersant. If you pre-saturate your dispersant with the whatever the active is dissolving, so your dispersant will be good to go for the your particle size determination.
Okay. Thank you very much, sir.
Yeah, you're welcome.
Thank you. Any more questions from the participants? Okay. If you have any questions, you can type. So I don't find any more questions here. So as there are no further questions, here ends our first webinar session. So I would like to thank our speaker, Dr. Srinivasulu, for the insightful speech. And I'm sure our participants this morning had a fruitful discussion with our chief guest. And I believe it will be helpful for our students as well. Let me give a quick information about Dr. Srinivasulu. Dr. Srini is an analytical expert with passion for analytical research. He has 16 years of experience in pharmaceutical industries. He's working towards the research of new technology methods for pharmaceutical dosage form. He's an expert in the core area of analytical research, method development, method validation, and stability for drug product. With that note, I thank Dr. Srini. Thank you so much for joining us, Dr. Srini, today.
Thank you. Thank you so much. Thank you all.
Yeah.
Yes, Professor Shivakumar, you want to add something?
Yeah, fine. Yeah, thank you, Dr. Srini. As a token of appreciation, we would like to give you a certificate of appreciation in terms of today providing a guest lecture to us. Soon it will be reaching to your email. Yeah. Kingston, can you just share it on a screen? Yeah, is it possible to share it on a screen so that Dr. Srini would be able to?
Yes.
Yeah. Dr. Srini, please accept our virtual certificate. Soon it will be reaching to your email. Yeah. Thank you so much for your insightful talk to us, and great appreciation towards your time, that what you have been providing to us. It's a wonderful time. Sorry to trouble you at this particular moment. Yeah, that shows how much you are fascinated towards the profession. Yeah, thank you so much, and we would look forward for your discussions in the future in terms of MOU and maybe other discussions in terms of research or research exchange, webinar sessions, and so on in the future. Yeah, thank you once again.
Thank you.
Yeah.
Thank you. Thank you.
And good night. Yeah.
Yeah.
Okay, our second session begins here, and the topic for this session is basics of phytochemical research. Now I call Professor Shivakumar, the head of the Institute, Geetham School of Pharmacy, to welcome our guest.
Yeah. Thank you, Kingston. It was a wonderful first hour session that what we had. Now we would like to move ahead with our second guest for today's session. Yeah, today I would like to extend the warm welcome to Professor Geeta. She has accepted our invitation, and this session is initiated by Dr. Uma Kritika. Thanks, Dr. Uma, also for bringing an excellent speaker for today's session. Yeah, with this welcome, I would like to request Dr. Uma to introduce the guests for today's session. Yeah, Dr. Uma, please.
Thank you, sir. Hearty good morning and warm welcome to all. Geetham School of Pharmacy greeted you all the happy and prosperous Yugadi. This is Dr. Uma Kritika on behalf of Geetham School of Pharmacy, privileged to introduce the speaker of the session, Dr. B. Geeta Saravanan, Professor and Head, Department of Pharmaceutical Analysis, Sri Abhirami College of Pharmacy, Coimbatore. Dr. B. Geeta Saravanan is recognized as a renowned speaker and inspirational academician in the field of pharmacy. Madam has graduated from Madras Medical College and pursued her master's and doctorate from JSS University under Quality Improvement Program. With 24 years of research experience, Madam has expertise in the core area of phytochemistry. To her credit, she has many national and international papers and reviewer for several scopus on Web of Science journals. With this brief introduction, I invite the madam to carry over the session and share her insights on basic principles and basics of phytochemical research, which will be useful for our younger generations. Ma'am, please take over the session.
You're not audible, Professor Geeti.
Yeah.
Not yet.
No. Yeah.
Am I audible, sir?
Oh, yes, please. Yeah, go ahead.
Okay. So very good morning and happy morning to one and all present over here. It's my great pleasure to talk about my favorite topic, like phytochemical research. Before starting my session, I would like to thank the God Almighty for blessing us all with our scientific sessions. I thank the principal, sir, for giving me the beautiful opportunity. Thank you, sir. And I also thank my dear friend, Dr. Uma Kritika, who is always supporting me in all my professional activities. And happy to hear from the frontline speaker. He has discussed about the particle size distribution in a beautiful way. Similarly, I'll do my best level to satisfy the younger generation for their phytochemical research. So with the blessings of Saraswati and all this, I wish every one of you happy Ugadi. And let me start my session, sir. Can you please excuse me? I want to share my screen, sir.
Yeah.
So should I get that? I think I'll get the support from technical team.
Ma'am, are you able to share the screen too? There is a green button over there at the bottom. If you could able to.
Yeah, but that is, it's giving us host disabled participant screen sharing.
Okay. Okay, fine. Yeah. Ma'am, can you share the PPT with any one of us, either to me or Dr. Uma, so that we will be able to.
Okay, sir. I hope it's.
Ma'am, it is visible. Yeah.
Okay, sir. Two more. Is it in full view mode, sir?
Yeah.
Okay. So once again, the research goes in different ways, and we are having the research like while I was before starting my views, I want to tell a few words. Most of our drug components so far we have seen in our laboratories and also as our medicinal compounds as drugs and nutraceuticals and dietary supplements. Most of the compounds or the drugs are having the initial lead molecule as from natural product. So the natural product becomes a very great source. So the research from the phytochemistry, that is the chemicals which are released from the plants, are classified into two categories. One is the primary and the secondary metabolites. So like how the primary metabolites are needed for our daily energy giving like carbohydrates, and secondly metabolites are secreted from plants. So secondary metabolites are secreted from plants. They have very good potential effect, and they classified as various categories like terpenoids, glycosides, tannins, phenolics. So in my talk, I'm going to talk about the basics, how to start a phytochemical research and how to conclude with a compound, how to isolate a particular compound by conventional technique and also using hyphenated techniques. So when we are understanding certain basics of phytochemical research through literature and through our practical experiments, it will become a very novel idea to start with a research. So in my, I have to thank my guide, Dr. Sri Shailappa Badami, who has made me this, what I am today at this stage, who is a natural man and known for the phytochemical research. I was working with sir for 10 years, and with that experience, I could deliver some few minutes about phytochemical research. So coming to the next slide. So I'm Dr. Geeta, and this, whether my slides are moving?
The slides are not movable. Slides are not movable. I think it has to be checked again. Yeah. Can you just reshare it on the screen so that it will be movable, Professor Geeta?
Once again, sir.
Yeah, please take your time. No problem.
Okay.
Ma'am, shall I share?
Yeah.
Okay, fine.
Is it okay?
Yeah. Yes. I think. Yeah. Now it is fine. Yeah.
Okay. So the plants are playing a great integral part of ancient culture of medicine, and India is a very good source for getting the like secondary metabolites. And we have explored very good invaluable compounds for the development of new drugs. So plants have a pressure of phytoconstituents. They differ in the molecular structure by nature when compared to the synthetic molecules. That means we cannot imagine the fragments which are created by the nature. So when we are analyzing in a synthetic laboratory, to start with the starting material and to get a drug, it's very tedious to get the drug molecule. But nature has provided with the source. Only thing is we need a lot of patience and we need a passionate to isolate the particular compound. So to start with the introduction to the plants, we have got many cardiotonics, many antidiabetics, beautiful antihistamines and analgesics. And when you name any class of drugs, everything most of the drugs are isolated from the natural products. So once we come across natural products, they have a very beautiful integral lead compounds in that, and the fragments which cannot be imagined, and they will react with the receptor site, and they will react with the receptor site, and they will bind very naturally. So with this, when we start our plant isolation, what are all the things we need to take care of? We are having an interesting review which contributes the value of the natural products in the drug discovery. And earlier, whatever molecules we have got from the nature, like from the antibiotics, from the source of microorganisms. So the beautiful drugs, anti-malarials like vincristine and vinblastine. Anti-cancer drugs, vincristine and vinblastine. Once it was not known, and after they have been isolated, they are providing us with a valuable therapies, chemotherapies. So these plants can serve as both as a drug as well as the plant products can serve as nutraceuticals and supplements. So coming to the next slide. So in India, most of the drugs are plant-based drugs, or in our traditional system of medicine, Ayush, which includes Ayurveda, Unani, homeopathy, and Siddha. So when we saw about this interesting discoveries, once this plant, the first drug, the Taxol derivatives from the first plant, paclitaxel, when once it was isolated, they could found out with the drug was the initial compound as having more adverse effects. But when they could found out that the accidental discovery, once again they resurgence it and they could find out a very beautiful compound, and they could come out with a molecule which is giving a promising anti-cancer activity. Similarly, the drugs which are the plant products, the plants like vincristine, vinblastine, camptothecin, and other drugs which are isolated from the resins are giving promising results. So these are the few examples which gives us a motivation to start as a phytochemical researcher. So plant-based drug particles, the plant-based drug molecules, papers will give you an idea that we can also isolate a compound when we do a complete research and we do a continuous precedence on patients. So these are the discoveries of the anti-cancer and drugs which are thought impossible one day, and it was found to be a possible drug and promising compound which could beat many of the synthetic moieties. So there are few other examples like aspirin, which we have the main source is from a plant like Salix species, and also we have digoxin. This is from Digitalis species, which we can see the importance, like they are having a very good cardiotonic and they are saving many angiotensive disorders. Similarly, when we are having anti-malarials, we could come out with a compound, beautiful compound, artemisinin from the plant Artemisia annua. So this was a new drug introduced from the Chinese. So when compared with the plant discoveries and the products, secondary metabolites from the plants, China is leading us because they are doing a continuous research. They take care about a very fine way in their documentation. So we are having working with many areas like many branches of science together. We are working in this field and we are going to get the compound. In spite of that, we are lacking in finding out the molecular moiety. So we have to still explore in sharing our knowledge in a wider way, and we have to come out with a proper documentation and standardization of the herbals. So this slide shows that many of the drug products are semisynthetic products. The lead compound is from the plant. So these are the few other examples which gives us a promising results for anti-cancer therapy like camptothecin and flavoperidols, nascobactam, which is used as an anti-proliferative, so podophyllatoxin and other drugs. So coming to the steps, what is today's topic is basics in phytochemical research. So how to start research? First of all, we have to take the plant. So before collecting plant or before targeting the plant, when we are starting our PG or PhD, we have heard about the novel plant or new plant. So what's a new plant? We will acquire knowledge from various sources like traditional usages and layman, like the people in our home itself. We will have our ancestors. They will be telling these particular ingredients will be used for these particular disorders. So we once we are going to select the plant. There are 4 ways, and there are extraction methods which has to be followed based on the targeting phytoconstituents. The solvent selection is an important criteria, and phytochemical analysis, that is the chemical test which is done in the laboratory, has to be taken care, and we have to be monitoring the chemical test and repeating the chemical test in order to get the correct or accurate value. And the in vitro methods will give us an idea where the exact point where we need to focus in our continuous research. So from the in vitro results, combined in vitro results, we will be able to find out a particular fraction or a particular extract which is going to give us a promising result. So this is called as bioactivity guided isolation. That is, the biological property is already promised based on the in vitro methods. So once the in vitro methods, most of the in vitro methods are giving promising results, that gives us an idea to focus on that particular extract or particular fraction to go for the isolation methods. Then comes the in vivo activity based on our area of interest, like whether we are going for an antidiabetic work or a cardio work or a CNS work. We can talk with the people, or we can select and do this activity based on the isolated. So when you get a better yield, the extract can be compared with the secondary metabolite isolated, or the component which is confirmed by all the spectral analysis as pure. So the various steps involved in the phytochemical research are: the plant has to be selected, extraction methods, solvent selection, phytochemical analysis, in vitro methods, and bioactivity guided isolation and in vivo activity. So this is what we are going to see in a detailed way. I'll take another 30 minutes to complete. So that based on the traditional usage and we can select the plant, the ethnobotanical information available from the Materia Medica and Ayurvedic medicinal plants like Kritika Basu, they will give you an idea where to select. For example, we are going to work with the terpenoids. So you can select a plant which is giving a promising results. So the ethnobotanical information is available in various sources like Ayurvedic plants as well as Indian medicinal plants, volume 1 to 5 by Kritika Basu. And we have Materia Medica and Wealth of India. So the Wealth of India will give you an idea like where it is available and how to collect all those things. The next part is the chemotaxonomy. Chemically and taxonomically related genus will be there, where there will be more number of promising results based on the literature. So I want to add upon one point here. While we are coming across our research, we could find an interesting point that one of the component, triterpenoid, was repeated in most of the extract. And while we are targeting the same, we could get almost the same result with the genus selected. So species selected. So the genus will have a chemical more which can be targeted. So based on the phytochemical analysis, what we have discussed earlier, we can do the chemical test correctly, and if the plant extract is more enriched with the secondary metabolites, then that particular extract can be concentrated for isolation. So these are the various basic things we have to collect. And after collecting, we have to authenticate the plant. That is, we have to confirm that whether the selected genus, selected species is correct one. What our literature and the practically collected sources matching by the government authorities like Botanical Source of India or any botanist. So we have to get an authentication certificate that the plant selected is correct. And the macroscopical and microscopical studies also help us in order to find out certain constituents, which is giving you a brief introduction about the plant. The physicochemical constants like water soluble ash and extractive values, the extractive alcohol extractive value, water soluble extractive value will give you an idea about how much amount of the extract you will get if you are taking some 100 grams of the plant. So this will give you a rough idea to go with the amount of extract. So what are the basic parameters? While the plant part is used as the starting material, we have to concentrate on two aspects, whether we are going for the secondary metabolites as such as a big molecule like polyphenols, or we are going to degrade that by if you are which extraction procedure is correct in isolating the targeted component. So these are the few points we have to be very particular about the nature of the plant material. That is, when we are collecting the plant material, we have to go through the literature. The seasonal plants, some of them will be seasonal plants, so they have to be collected in that particular season to get the enrichment of the targeted secondary metabolites. And also that certain plants will be having more biologically active constituents if they grow in this particular area. So its origin is very important. And after collecting the plant, there are methods like you have to dry in a shade, maintain at a temperature. So the processing of the plant and the preserving of the plant material also plays a role. And we have to preserve it from attack from other microorganisms. So moisture content and particle size needed. For example, we are going for a type, what are the types of extraction? You are going for a oxalate pinch coarse powder. The particle size should be coarse. So these are some preliminary things. So we have to concentrate on all the preliminary things like types of extraction, time of extraction, the temperature which has to be maintained, as well as the solvent concentration and the polarity. So these are the preliminary idea we have to have before starting our research. So if we are concentrating on particularly terpenoids or flavonoids, then we can go for the chloroform extract. And if we are concentrating on the particular polyphenols, we can go for water extractions or more polar solvents. So we are having any promising steroids, then we can go for petroleum ether extract. So based on the secondary metabolite targeted, we can go for the solvent selection. So this is the oxalate apparatus, and the second picture is one which shows that a rotary evaporator, which helps us to maintain the temperature in an optimum level and to get the extract without affecting any phytoconstituents. So there is a water bath, and we will be taking our extract. So this rotavapor extractor will help you to get the concentration of both the extract as well as the fractions from the column chromatography. So this way, it will save your time. So if you have a setup oxalate apparatus, it will go for continuous percolation method. So mostly we have to check. So there are some tips here. What are the tips here? Means we have to check the Mandel's temperature along with the thermometer externally, so that if we are keeping at the intensity and the temperature should match. So there is a band which says 0 to 100%, and we have to check for the optimum temperature with the help of a thermometer. So there are other various ways of extractions. Today when we are concentrating on a particular phytoconstituent which is not affected by heat, then we can go for other innovative extraction methods. Like we know that this particular phytoconstituent can be extracted by through literature, then we can go for the innovative techniques. So how like we are concentrating on computer-aided drug designing or bigger molecules, we can also concentrate for the computer-aided design with the plant molecules, and these can be combined with the other combinatorial chemistry and other technologies in order to prove its biological activity, or else whatever isolated compounds can come as a lead. So this phytochemical analysis is concentrated along with the other total phenolics, flavonoids, which gives an idea like choline thiocultive method, which gives you the total phenolics. So earlier I have told that when you are doing the chemical test, documentation is very important. So we are doing, for example, you are concentrating on 4 extract by continuous percolation method, starting from petroleum ether to ethanolic extract, petroleum ether, chloroform, ethyl acetate, ethanol. So if you are seeing that the phenolics are more with ethyl acetate extract in case of your phytoconstituent, then the same will be like reflected in the exponential Cultis method. So we can see sometimes the extracts will have a higher potential, like higher amount of phenolics when compared with the gallic acid. So certain plant extracts will have more amount of phenolics when compared with the standards. That means they are going to give that particular extract is having a promising phytoconstituent. So the total phenolics and the total flavonoids will give you an idea for the amount. So the quantitation of this total phenolics and total flavonoids will give you by standard methods will give you an idea to know about the biological value. And coming to the in vitro studies, after completing the in vitro results, in vitro quantitative estimation of phenolics and flavonoids, we can go for the in vitro antioxidant activity. So there are various types of antioxidant methods, like using various radicals, ABTS assay, nitric oxide assay, and NDA assay, TPPH, and so on. So the total antioxidant capacity is also measured by phosphomolecular methods. And if you compare the results obtained from the in vitro antioxidant activity methods, we could find that our initial findings will match with this in vitro antioxidant activity. And here one point I want to say here is once you complete your in vitro antioxidant activity, you can have a comparative chart which plays like a very greater role, that if a particular extract is showing a promising result in most of the methods, then that extract can be again subjected for in vitro activity. So if your activity is anti-cancer activity, then we can go for the cytotoxicity studies using MTPSA and SRBSA. So in case we have short-term and long-term cytotoxicity, if you get a better results in short-term activity, the same fraction or the extract can be subjected for long-term cytotoxicity assays. So coming to the basics in isolation, this is the technique for column chromatography. It's an absorption chromatographic technique which is used to isolate the component from the plant extract. There are two types. One is the wet type and the wet packing method, and other one is the dry packing method. So there are some few clues here in the column chromatography. Once you are studying a column chromatography, you need to arrange all the column chromatography is a long process. That is, it's a time-consuming process. So the time so in order to get the component in a better way, or for example, we are concentrating to fractionate to avoid the admixture of one component with another component. So while we are taking a column chromatography, there are some few preliminary precautions to be handled. If you are going for a wet packing method or a dry packing method, the stationary phase to be chosen according to the phytoconstituent. And the stationary phase should be dried overnight, and before starting it should be dry and free from moisture. Why I am telling this is even that will help you to get the component in a better way. So during your solvent addition, there are some colorless components. So we need to focus on the colorless components. So the length of the column and the volume of the column should be calculated. And once if it passes through the whole column, for example, we are taking the urate, it's 50 mm. So like that, we should be particular that whatever I'm that if a solution is passing through the column, how much volume I will get the fractions. So fractions has to be monitored, and the fractions has to be carefully tuned. So this is an experiment which shows like there is a band coming out here. So if there is a colorless band coming out, we can go for the UV light. So the UV light, if you are keeping in a TLC plate and checking in the UV light, you can see the spots visible. So then if you have to go for thin layer chromatography, like you can do it in petty plates, and you can pull it together. So what are all the things we have to concentrate in column chromatography? We need to take very much care in pooling the fractions together. That means you're collecting 25 ml fractions for the first 10, or 25 ml. You're collecting 25 ml in beakers, or you're collecting 50 ml fractions from a crude extract. We have to check it in DLC. And before mixing the fractions or before concentrating the fractions, we have to be very sure about the constituents. Like sometimes what happens while collecting and cooling, we should not admix any other components or TS fractions. So what I mean to say here is, for example, you are getting a component purity in 25 to 30. That fraction has to be kept separately and to be concentrated by the natural method, and it has to be checked for its homogeneity. So thereby you can isolate easily. So in the column chromatography, the precaution is the pooling of fractions. So if you do the pooling of fractions properly, then your isolation becomes very easy. So then addition of solvents. Before adding solvents, we need to check the purity of the solvent. So like sincerely, we have to distill that and we have to add. And we have to, while you are adding the fractions, for example, we are collecting some 10 to 100, we are collecting 25 ml fractions from first fraction to 10th fraction, it will be 25 into 10 to 50 ml. From again, we will be going for collection. So that time you may be, this 250 ml will give you a component, and there will be another component which will come. So there are chances that we can isolate a phytoconstant very easily when we are doing a column chromatography carefully. So fractions collected in a column chromatography has to be monitored by the TLC, and the isolated constituents has to be checked for the homogeneity. That is, you need to get a single spot by the TLC, and while you are doing test for you know that particular component you are suspecting by the literature as a triterpenoid, and you can confirm it with a chemical test. So then characterization by UV, IR, H1 and C13 mass. So there are literatures available and libraries available. So if we get known compounds, then they can be matched by the peak matching technique. So these are the easiest ways to avoid that mixture and to avoid the tediousness of the column. So this is what thin layer chromatography is done to. So our lab setup is not happening always. Then we can do thin layer chromatography, where we can go for when we know the particular fractions within particular components, then we can go for a preparative TLC. If you have the RF values different and it is more, the RF values are designated for the component as 0.2 and for the component as 0.5, then we can cut the plate and we can go for evaporation, simple evaporation, and get the component easily. So preparative thin layer chromatography is a beautiful technique when we know the number of components by doing in an analytical thin layer chromatography. So when we know that the particular extract or the particular fraction eluted from the column is having two components. Example, we are having two components which differs in a RF value widely, then preparative thin layer chromatography is the easiest technique where we can get the components easily. Then we come into the HPTLC analysis. HPTLC analysis is one particular tool in the phytochemical research. When we can compare the tools with when we can compare the extract. We can know about the number of components placed, and also we can while concentrating on the standardization of a particular herbal. This HPTLC analytical technique is a beautiful tool which will give you your amount of phytoconstituent targeted or the amount of standard. So we can have the 2 to 3 ideas during HPTLC. Like we can concentrate on the amount of a flavonoid if our compound is from enriched with flavonoid compound. So HPLC analysis is a tool which helps us to find out the nature of the extract as well as the fraction eluted. So then comes like HPLC instrument. There are two types, one is analytical and preparative. So while you are having any one fraction which is giving a which is giving a one particular homogeneity which is stored in the TLC as well as in the HPLC, then that particular fraction, that particular component, if it is more in a plant, we can further confirm it by the LC photography technique. And there are certain tips here. We can keep a bigger point solvent collector. So in that, you can keep a beaker, and that beaker will give a component. So we have to apply some of the techniques which if we are confirmed that this may be my compound. So the research about column chromatography actions, a particular thing that the precaution will be handled is the second sorry, I have to tell about the chromatography. If you which is having an can go chromatography. And the column chromatography helps us if we know that the particular fraction is containing only these number of components. So I know that my 100 to 150 fractions, then I can go for the chromatography very slowly and sort of particle size minimum, so that the dilution or the number of theoretical rates will be more. So when I go with the which will be when it is treated, it can come to an idea that my component of plant is my extract is having a particular phytoconstituent enriched through the peaks and mass. So by matching these kinds of technique before starting our research, we will get an idea of the constant. So this is the beautiful thing. And there is an LCMS which will help you to analyze known components between sources. So LCMS will give you. And in LCMS technique, whatever the component eluted under cryptography will be asked to a protocol analyzer and you will get the content. So the basic will give you an idea of the component. So these you are talking about basics in the research. So once you are having and you find what is having a more individual and you have got a component which is more in that plant sector, then isolated constant and the particular extract can be subjected for experiments, that is so based on your target, based on your selected study, if it is magnetic or it is maintenance, choose model and you are selected new species from a genus already available. Then the first one is advocacy studies, studies and report. So this is a very important. So studies has to be reported. Even if it is a species, again, you need to do the safety of the. In terms of biological parameters, it is a vital thing on the studies. Idea like my extract is if I'm targeting on a particular cells. So this cellular cycle will give you this. So the biological parameter, all this, and while you are For example, you're doing some issues. There are certain usage we need to we concentrate on the storage of the issue. So on concentration in the textbook has to check, and if so, if you are giving for a laboratory, you can ask analyst whether this particular concentration. Why means once you are doing animal activity, we are taking 30 days time, and the final day we are dissecting all the issues and the correct concentration of that storing liquid. So these are all some of the cautions we have to take. And nowadays we are having equal responsibility as the phytochemists have equal responsibility in knowing how to interpret our research, or while we are doing phytochemical research, getting a promising compound, and how to go for further activities. So these techniques like to get research and looking for computers enrich the particular for the students advanced text, and you can do a compound limit and compound. So the target is to come out with a lead compound. So when you do a continuous research for the so I have covered some of the basic finding research. Summarizing today, you have to be very careful with the plant processing, be careful in selecting the solvents and putting in the has to be careful. And the one more attitude is large patients I to share here some of the practical experience in the tips and tricks. So if you are collecting some content, finding that my compound is clear, it is imbued with another constant, which is, for example, you are having a white color crystal. It is imbued in green color. Then what is the idea is you can remove those green compounds with those and you can use that. Today, wash glass and wash this one and take it out. So this is a simple trick. Avoid tedious the isolation. But once you get to the compound, definitely crystalline compound in natural in the research in a crystalline compound means it is definitely a compound, so you can isolate by using the tricks. What are coming defects first isolation, we could find out the solvent extraction, but you can use a partition coefficient principle and use solvent extraction. So the extraction technique we can and use this and to be first if you are particular laboratories having the other techniques. So we while doing our research, we will find out some jokes also in our laboratories, and when documenting our research in the definitely while starting from chemical analysis till the end of your research, we need to concentrate in the documentation. Once you are documented perfectly, the observation will be perfect. If you're finding some interesting, the person has to be monitored. And one more, sometimes we get false results also. For example, in the chromatography, is going and taking the polarity scale from the non-polar to polar. And
Professor Geeta, your voice is breaking. Your voice is breaking. Can you please check your earphone?
Is it okay, sir?
Now it's okay.
Yeah, the just only the few minutes. I think the voice was a bit slurred. Yeah, now it is okay, Professor. Yeah, please proceed.
Okay, sorry for question. Now it's okay, sir.
Yeah, now it is fine.
Am I audible now?
Yeah, now clear, Professor.
Why we as a team we are working on that, but we could find out that we could take out things like are doing PG by doing this among the techniques which is coming in our brain with our we need to apply something in categories. And one more, I like now I'm going to complete the conclusion. Before I'm concluding this, I'm to share one more team effort. Like you are the get knowledge and those things was teams. Because column from a column from the support IT members tips. The most important tips. So, make the best so, it is the isolation to find out in most issues very so if we are focusing on that one particular thing, we are enriched at definite source and we are having more knowledge when compared with other countries. This is a role. And technological advances, all complex natural products. Nowadays, we are having initial station was very tough. But now libraries are available, but already isolated compounds are available. So we can easily do the spectral interpretation in this way and by talking with this also by our own. When you explain when you get the results, we can interpret the results by the hyphenated techniques like C13, C, and also in mass spectral analysis, we are getting beautiful results. So nowadays the integration isolation becomes easy because of the hyphenated techniques are available. And natural product natural product is a source for ending up of the diseases. Also, it uses energy to survive. And the natural product is the major role as a chemist. If you are having interest and you are having interest with this integration of plant-based research, everybody should do having a number of pressure compounds like we may not be known today. We will be coming out with patients and research. Thank you for this wonderful opportunity. Thank you. If you have any questions, I'll be happy to answer.
Thank you, Professor Geeta, for your talk. Participants, kindly post your questions in the Q&A section. And if you want to interact directly with the speaker, kindly raise your virtual hand so that I can unmute the mic.
Yeah, to start with, Professor Geeta, it was a very wonderful insight about the basics of the phytochemicals, how to start the research. You have given in nutshell how the research work has to be initiated. I do have one or two questions to share. I think, can you give your insight regarding how to scale up the isolated products when we are isolating the compounds that what we are isolating may not be ensuring reproducibility when we do it again. Anything that you would like to add on, Professor?
Sir, like we are by repeating this, when we are isolating a particular something, again the component is a new component, and you have followed the system.
Prof, sorry, Prof, your voice is not very clear. Prof, sorry to ask you, so your voice is not clear. Maybe I can suggest you to hold the mic, what you are speaking, slightly closer to your mouth. There is a lot of vibrations, I feel. I think that will be able to make us clarity. Yeah.
Okay, sir.
Yeah, it's very clear, Professor. Sorry for interruption. Yeah, please. Yeah.
Actually, we have got a plan. I share my own experience. We have got a plan. We have got a plan that has a promising component to our. When we repeat that 2 to 3 times, we could get the yield of the isolated compound. So what I mean to say is, when you have extract, so initially you are focusing on the lead molecule of secondary metabolite. Have your extract more, that is during your you collect it more. You want to preserve it for whole, and you get interestingly accidental results. For that also you need to have the extract in way. So what I mean to say is, once we are doing research, first part is our extract yield is more. So we have to have a quantity in our extract. And in case of column, you're getting your question is whether the components are reproducible. Yes, it's reproducible. Only thing is, we have the home needs to be confirmed by the hyphenate techniques. Once if it is confirmed, sure, while we repeat, we will get it, sir.
Thank you, Prof.
Hope I have answered your question, sir.
Yes, Prof. Yes, Prof. Yes. Yeah. Thank you.
Yes, Prof. That is
I have justified. Yes, sir.
Yep.
Yeah, Professor, there's another question which is posted here. How to get the extracts in powder form? Because many plant extracts end up as a semi-solid mass even after freeze drying.
It's not a. It depends on nature of the plant. Once again, selected plant. For example, if you are it is the nature of the plant source only. So this are semi-solid compound. If it is semi-solid and aqueous extract freeze drying techniques, if it is followed properly, then we can get it powder form. But mostly we get the extract in according to the nature of the plant. That's about the nature of the plant chosen. And sometimes according to the plant also. If you do reason, for example, in dry conditions or in summer, all the locals to get this beautiful.
Okay, there is
the stability issues. Yeah.
Yeah, there is
I'm
another.
I'm able to read some of the question.
Yeah, there's another question.
Yes,
another
sir.
participant wants to interact with you. I'm unmuting the person. You can have interaction with them. Yes, Sunita?
Yeah. Good morning, doctor. It's a nice presentation. Can you hear me, madam?
Thank you, ma'am.
Yeah.
Yes,
So,
ma'am. Thank you, ma'am.
Yeah. So what are the stability issues you have faced during their isolation and characterization and or even during the formulation development? Because one of the problems with the phytochemicals is stability issues. Agree?
Yeah. Yes, sir. Yes, ma'am. Agreed. But like we, as a chemist, what we used to do is while we are while we are fractionating or while we are preserving the extract, we used to follow the normal conventional things, whatever in the literature. And the stability issues during isolation and characterization, we used to store the components in a designated isolator. So the
Can you
packing
please repeat?
and
Can you
other
please
tips we
repeat?
will get from the, yeah, ma'am, we will have a desiccator in our lab. So
Okay.
if we want to, we will be packing in some sealed polythene covers, or sometimes they will be. We will ask the suggestion from the scientist also to store this. One of my phytoconstant till like it was a promising result in vitro, so I asked the stability that, and because we are able to preserve somewhat in the desiccator.
Mhm. It's not clear, ma'am. Actually, the voice is breaking. It's okay. Because we were working with the phytopharmaceuticals because already which are there in the market also, they have a lot of issues with the when they are exposed to the temperatures. Because end of the day, if we want to bring to the market, we need to subject to the stability studies as per the ICH guidelines. Agree? So in that case, any specific guidelines they are there, which are given by the regulatory agencies also for the phytochemicals?
One, like I hope there is a quality control standardization of herbals available as a text. If I could get it, I could answer. Now I'm not able to recollect that point.
No issue, ma'am. No issue. I'll just mail you also.
I have a standardization of herbals. I'll mail you. I have a got one standardization of herbals paper, which is giving all these details, whatever you want. I'll check it and I'll mail you.
Yeah. And there is one more question, ma'am.
There is a, yeah. To add on to your question, there is one book, quality standardization of herbals. In the reservation chapter, how to repeat and how to present.
Okay.
Quality control standardization of herbals. I'll go through my literature and I'll
okay, ma'am. Thank you. Thank you very
my
much.
email ID,
I'll collect it from Dr. Shivakumar.
Okay, ma'am. Thank you, ma'am.
Thank you.
Question, ma'am. Thank you.
Thank you, ma'am.
Thank you. Any more questions from the
Any other questions?
participants? Anyone else want to ask some question? If you could raise your virtual hand, will be helpful.
Yeah, if it is from student side also, basic question also, I am ready to help you. Yeah, if it's from student side, they are really the future farmers, then I'm very helpful. So, thank you. If I have any questions or any doubts, like I can means I'll mail through mail. Also I can answer.
Okay, as there are no further questions, here ends our webinar session. I would like to thank our speaker, Professor Geeta, for the phytochemical perspective speech. I'm sure our participants were able to learn about the steps involved in phytochemical research and the parameters for the quality extract. I believe our participants gained new information on phytochemistry. With that, let me share the virtual certificate for Professor Geeta. Professor Geeta, can you please unshare your screen?
Okay. Okay, sir.
Yes, Professor Shivakumar.
Yeah. Professor Geeta, thank you so much for accepting our invitation. Please accept our certificate of appreciation for giving an insightful talk about the basics of phytochemistry. Always being a phytochemistry, being a lead for the research in various concepts. I think you have enlightened us to provide a lot of contents. I would also share the certificate to your email, and if we'll also share a hard copy to your address, I would be able to collect it from Dr. Wu. Yeah. Thank you so much, Professor, for giving us a lecture today. Dr. Kingston, can we propose a vote of thanks? Yeah.
Yeah. Thank you so much for the participation in this webinar this morning. We had two speakers this morning, one from United States and one from Coimbatore. I believe both the sessions were really helpful for you, for both the faculty as well as the students. And thank you so much for finding time during this auspicious day and able to attend this webinar from 9 to 11. Thank you so much from Geetham School of Pharmacy, from the faculties and students. Thank you so much.
Okay, sir. Thanks for the opportunity and also sorry for the interruption in between the respective nine sessions.
Thank you. Bye.
Thank you, Prof. Yeah.